Okay, hello everyone. Today we're talking about the course, the PsyTechCBT course, the CE workshop we had a few weeks ago. And we have a guest today with us, Dr. Lynn Panattoni. Dr. Panattoni, so please, if you can introduce yourself and the field of practice and how you work with VR.
My name is Dr. Lynn Panattoni. I work in the clinical psychology department at Turnpaw Health. I am a functional psychotherapist. I have been using VR therapy, PsyTechVR, for 2 years now.
When we started PsyTechVR, we didn't have any course. We had some technical courses like onboarding, but next we decided that we would like to create a workshop given by clinicians. So what was your motivation to attend this workshop?
I'm always looking for evidence-based treatments that will help me personalize the patient's healthcare plan, and VR therapy is that treatment. So I was very excited to see this class offered.
And you mentioned that you used the VR therapy before, like 2 years ago. Can you give us like a few examples how you apply the VR in therapy with your clients?
Sure. My patients are dealing with chronic illness. They're also suffering from severe anxiety, depression, insomnia, phobias, panic disorder, stress, PTSD. And VR therapy has helped reduce or eliminate their symptoms. It has helped them to feel confident to manage the world they live in. So in a session with me, I'm able to take them into PsyTech to a safe place and help them practice breathing exercises, some meditation exercises. It helps regulate the vagus nerve and helps them learn to emotionally regulate.
Great, thank you. And so after practical question, I got another one about the workshop. Speaking of this workshop, what part of this workshop did you find most valuable for you?
Dr. Ruddick and Dr. Smith take you through a session, starting with the assessment, why it is so important to do a thorough assessment. They talk to you about the equipment, how to use the equipment, and then as a clinician, how to engage and interact with the patient while they're using VR. It was very informative.
Great. I think I got one side question, so which I sometimes face with other therapists. So, for example, you purchase a headset and you start training, you start getting familiar. So, what's like a first step for you to get started with clients? Do you think it's necessary to go over the whole VR exposure protocol, or you think it's necessary to start partially? For example, to start with small pieces, like offer one client a safe place, also to become confident with technology. So what do you think of this? Should we go like all in with VR or start partially?
I think we should really focus on doing a thorough assessment and start by working them, titrating them up from small exposures to, of course, going into the VR system, maybe timing it. It could be 5 minutes, working their way up to 20 minutes, depending on what the patient is dealing with.
Great. Thank you. Okay. And the last question I have, what would you say to other professionals considering attending the workshop?
I would say don't wait. Taking this workshop, by the end, you're going to feel confident to use VR therapy in your practice. It's a game changer.
Thank you.